So I just wanted to discuss some of the considerations when it comes to the recent trend or the ongoing trend in reducing entry standards to some of our tactical occupations. So namely, I just want to talk about law enforcement and the military. So some of the things that I'll sort of cover over the next few weeks, or I'll make a few videos to discuss them, is kind of the impact that lowering the entry standard or the entry requirement it has on injury rates, okay, that it has on decision making or use of force or the way people conduct themselves in these environments. It has on something known as action capacity, and I'll explain that in a little bit more detail in another video. The impact that has on training quality and quantity, because you're reducing the ability for people to undergo training, the ability to recover, and the ability to actually learn from training. The impact that has on payouts for pensions, for incapacity payments, for people who are medically unfit for duty or medically discharged. The impact that has on suicide rates, because there's a lot of data that associates involuntary medical discharge, specifically in the military, to increase suicide risk factors. Okay, the impact that motivation has on this, because if people can't meet a really low entry standard, then are they really the right people to go and perform really well in these complex, demanding tasks or operations or occupations? Okay, the impact that has on retraining and the ability to continue training these people, because if you've got high turnover rates like we currently do, you're constantly training people regularly because they're leaving in sort of 2 years, or if you've got a career span that's 2 years, you're training people essentially every 2 years rather than sort of 3 or 4 years, which is what some of the previous training or career spans were. Okay, so firstly I just want to talk about what a standard is. So you can't really say you're reducing the standard, because the standard is, or the standard should be, done from an operational needs analysis or an operational need. So it's essentially, or basically, the ability or the minimum standard someone has to be at to go through and conduct all the regular tasks or routine tasks they do throughout their day without undue or excess fatigue that's going to create ongoing issues, or it's going to create injury or mental health issues or PTSD or any other mental or psychological problems. Okay, so that's the minimum standard. The minimum standard they need to be able to do their job, all those tasks, but also allows them to be able to successfully negotiate worst case scenarios and be able to solve those problems with their ability and the resources they have access to. Okay, so you're not really lowering a standard, because the standard is the standard, it can't be lowered. And you could also argue that the standard required to do these roles may have actually increased over the last few years. Okay, when you look at it from a military context, the loads people are carrying have increased over the last number of years. Okay, when I was in the military, I was carrying loads upwards of 50 to 60 kilos at times. I think on a few occasions it was up around 70 kilos. Okay, and some of those for extended durations of time. Okay, the technical requirement or the increase of technology on some of the systems that people are using requires a higher level of competence to be able to utilize these things. Okay, some of these environments have become a little bit more complex with the introduction of technology, okay, with asymmetric warfare, with the way some of these battles are being fought these days. Okay, in a policing environment or a policing perspective, okay, the use of force options have increased. So the tools available to them, or the accoutrements available to them, have increased, which creates more cognitive load. So you need people who are actually better able to analyze the environment, assess options, and then be able to act appropriately. The weight of their equipment has increased, so they need to have greater physical capacity. Okay, you could argue that society has become more complex with the increase in alcohol, substance abuse, drugs, all these other factors that have created a more complex environment, which we now have multicultural sort of, or a number of different cultural backgrounds. Okay, so it's made these jobs more difficult. So if anything, the standard probably should have increased. Okay, but instead, to improve the numbers, and some of our organisations are at record lows, people have decided to go for a very easy or a lazy option. Okay, and that lazy option is to lower the entry standard. Okay? I understand the fact that society has become more sedentary, people have become more overweight. Okay, obesity, we've got diabetes, we've got all these problems in society because people have become lazy themselves. Okay, we've become too comfortable in our environment, and that's created all these ongoing issues. So the entry standard essentially has to slide left with a diminishing population standard. But without an intervention to then meet the exit standard required for these operational tasks, we're creating a future consequence. So what is essentially they look at as an easy solution now, or a lazy solution to a much bigger problem, by just lowering the entry requirement to allow more people in to fill the problem, is going to create a future consequence, okay, or potentially a future consequence. So over the next few weeks or next few videos, I'll talk about some of these other factors. Okay, I just wanted to kind of get people to think about what a standard is, why we need to maintain or potentially improve our standard, to be honest, because we shouldn't compromise that, okay, because compromising that standard within the military compromises national security. Reducing or compromising that standard within policing, okay, compromises community safety, okay, so they're not reducing a standard, they're just ignoring it, and they're just allowing or being comfortable with or accommodating a lower level of person coming into these organisations. And I know there's circumstances where it's not just physical testing, some of the psychological testing and other testing has been reduced or the entry requirement lowered to allow more people in. So by reducing the competency of your incoming population, you're creating a future negative consequence that somebody else is going to have to confront and solve that problem.